Hello everybody, Luke here. As you can see, I have at least parts of a client set up for us on this table. This is part one of a basic massage protocol for beginners. Our primary goal today and in these videos is to really reinforce developing a set pattern that we follow for just covering the whole body from beginning to end, and thinking in terms of that based on what position the client starts in. Most commonly they'll be face down in prone. Where do we start in that position? Where do we go right after that? And where do we end? And then when they're on their side, where do I start? Where do I end? When they're supine, where do I start? Where do I end? Once we reinforce that pattern, it doesn't matter what position the client starts in. I start at the exact same place I would begin no matter what the pattern of the whole massage is. So if they start in prone, I always begin at the low back and then work my way out from there. If they happen to, and if they end in supine, I start in that position on the thigh, the quadriceps. If they happen to start supine, then I do the same thing. I start at the quadriceps and work my way out, and then they'll end the massage in prone, and I still start at the low back, and then in my pattern, end at the feet. So you will be seeing me demonstrating my pattern. Over the course of time, if you develop your own, that is perfectly fine, but you want to get that pattern so good and below the nose that you don't have to think anymore about where you're going to begin and where you're going to end. This allows you to more effectively think about what you're doing to the tissue of each body area. So with our protocol of where we start in the body and where we end, we also need a protocol of what we do in each one of these areas. Now, optimally, I'm able to apply all massage manipulations and stresses to each layer of tissue in each body area, but based on the positioning of the client and the size and shape of the tissue, some manipulations are easier and or harder. So sometimes I use gliding strokes and kneading strokes and joint movement. Maybe I try to combine that all together. But sometimes you will see that it's more just glides and kneads, or more only glides, or more only kneads. That is only associated with the convenience of working on each part of the body depending on what position it's in. So I'm always thinking about what's convenient for me and what's best for my body mechanics. So you need to always think like that. This is the benefit of working on each area in general, at least 2 times throughout the session from in different positions. That way you manipulate the tissue at different angles, and that will help get the results that we're looking for. So in that, I have my notes here. So after this part, I will reinforce just the general full body pattern. Right now I want to talk about what we should be thinking as we work on each part of the body and in terms of each layer of tissue, from the skin and superficial fascia to the deep fascia in each layer of muscle, all the way down to thinking in terms of the joints and the joint capsule itself. So the tagline here is depth and direction. What is the depth of my pressure level? How much compression am I applying? How much pressure am I applying? And what depth does that mean I am into the body? What layer of tissue am I on? What layer of tissue am I moving? Depth and direction. With the direction, I am thinking in terms of the shape and function of the muscle. Is the muscle, like here on the hamstrings, is it longer and more of a tube shape? Or is it more like the glutes and or shoulder muscles? Maybe it has more of a triangular shape or a rounded shape. That guides my thought process in terms of what forces do I want to put, what stressors do I want to put into the tissue so that I can help it perform its function as best as possible. So what you'll notice is that muscles that do only one movement tend to be longer and tube shaped. Muscles that do many motions, like around a ball and socket joint, tend to be triangular or more trapezoidal. So when I'm just thinking about that as I work, if I'm working on the hamstrings, I know that they function at the hip and at the knee. So in this case, related to the knee and the elbow, I know that those muscles do flexion and extension. When I'm working in a ball and socket joint like the hip and or the shoulder, I know that the muscles that attach to those structures can do, not each individual one, but I know they can do every motion. They can do flexions, extensions, abductions, adductions, and rotations. So I have to keep that in mind. As of now, it's going to be easier starting out to, as we look at these muscle pictures and guides, look at the shape of the muscle, and if the guide shows the actual fibers, the lines that are in the muscles and how those are laid out, I use those as a guiding point. But a simpler thing even is to think in terms of the skeleton. So if I am using the spine as my reference point, or just the bone structure in general as my reference, I want to work perpendicular to the skeleton, parallel to the skeleton, and then diagonally. If I apply massage manipulation and stressors to the tissue in all of those directions, that's going to, if I follow that pattern from superficial to deep, I'm going to basically get every layer to move in every direction, and I don't have to think too much about it. So with depth, I'm thinking about what layer of tissue am I in, and with that I am always going to work superficial to deep, so light pressure to deep pressure, and then I think about the direction. And if I'm thinking in terms of that whole parallel, perpendicular, and diagonal, basically it just means I'm always drawing, every time I'm doing a gliding stroke or a kneading stroke, I'm thinking plus signs and X's. Plus signs and X's. If I do that on every single layer of tissue and each area of the body as much as possible, then that's gonna get all the benefit that I need for the most part. And then over the course of time, as you understand the nature of the anatomy and what each layer of tissue does, I can get more and more specific. So thinking in terms of the skin and superficial fascia, the importance of moving that can be for lymphatic drain. I might change my protocol a little bit if that becomes my goal, but that just means I'm working and thinking in terms of that very initial top layer of tissue, as opposed to thinking about the second and third layers of muscle and making sure they are able to slip and slide so that each individual muscle can function effectively because it's not stuck to something below or above it. So how do I do that? We covered the other idea, as I indicate this, is a concept of mimic normal. Mimic normal means that I am mindfully working my way through each layer of tissue, trying to help it function normally. The tagline with this is no mindless rubbing, okay? Now, as I'm going to be demonstrating this, I have these models out to hone in on a few specific concepts of at least specific layers of tissue that I'm going to focus on. One is the deep lumbar erector spinae. Okay, I'm going to move the arm here out of the way so you can see this better. So the importance of this is that the erector spinae do follow the entire spine, but this is a thicker group of muscles, but they're close to the spine, and it does go all the way down onto the sacrum. So people with low back related dysfunction, behooves the massage therapist to find an effective way to apply pressure to these muscles as well as the connective tissue here, the lumbar dorsal fascia, in order to free up this tissue and help everything move more effectively. The issue is I have these bony prominences that can get in my way. So I want to find a way to work on this muscle without hitting the ilium or the spinous processes. This is the one time when I demonstrate, and you see me actually do the protocol in prone, I do start the application with the edge of my elbow, but I'm going to flatten out almost immediately. I'll usually draw my hand down the spine, and I'm checking in and trying to feel for the top of the ilium. So I might do this and make contact with the top of the ilium right at the belt line, and then help that guide me, along with feeling for the spinous process of the spine. And I want to be between that and that. I want to be between those two bony structures. I know that's where the soft tissue is. So if I bring my hand here and begin my compression with my elbow, I do this only because this is a very small window. This is a very small space, and so I have to use a smaller point of contact in order to get compression there. Now, I'm not going to apply a lot of pressure straight down. What I have to be careful of more than anything is applying pressure directly onto the spine. So just make sure you're on the side of it. And if you're doing this, check in with the client. That doesn't feel like it's too bony. It doesn't feel like you're hitting the spine too much. So my pressure is going to start here with the elbow, and then I flatten out as I draw up. I'm trying to make contact with this tissue here, and then as I flatten my arm out, I'm hoping to pull and create tension on it up and away from this whole pelvic low back region. This is a common area for multitudes of dysfunction. So finding a way for me to pull that tissue up and away is very beneficial. So I start with the elbow, and I'm going to flatten out and then draw upward. That stroke, and what I'm showing, one of the other issues with it is it doesn't usually allow for good body mechanics for the therapist. So having a step stool, or if you have an electronic table, adjusting the height so that you can come down more straight down into the table / the client. If you're higher up, you'll be able to apply that force more effectively. So that's the goal that you're going to see related to the lumbar erector spinae and or the lumbar dorsal fascia. It's a really good angle, and it's just a matter of being mindful of the skeletal landmarks, the bony landmarks that we're looking for, and shifting our body mechanics in this specific instance in order to get good leverage and good compression. So related to the low back, in this position, we always also have to think about the hips. So when you see me applying compression in the hip area, in terms of the actual specific muscles, I'm going to be thinking in relation to glute maximus, which sits over top of these muscles, the deep lateral hip rotators. So again, I'm going to be looking for these bony landmarks. The top of the ilium, I know I have to be below that in order to be on glute maximus. And here, the top edge of the femur, specifically the greater trochanter, I know if I'm just lateral to that and posterior to it, I'm going to be able to work on these deep lateral hip rotators. So my the positioning of my forearm is focused specifically towards that. I'm here and then work my way down, and then you'll see some joint movement. But the idea is that I'm affecting not only the glutes, but these deep lateral hip rotators. Very important, and you can see the good old sciatic nerve here. It's a common issue for entrapment near or around these structures. So by me applying force and changing the shape of the tissue, it almost always helps. The other aspect related to this whole low back hip area is going to be working on the lumbar region again, but when they're on their side. Right here, this model is showing that you got psoas as well as quadratus lumborum. But what gets lost in this idea is that the abdominal obliques and transverse abdominis wrap all the way around and feed into a unified, deep fascial attachment site. We call that the lateral raphe. And then think of it just as a big seam where these low back muscles, as well as muscles of the abdomen, all come together. And I can really do, I can get good mechanical advantage and a good compression onto those tissues by turning the person on their side and coming in this way. The trick here, I don't have the ribs to show this, but what I have to be mindful of is not applying too much stress to the floating ribs, which would be down about here, or being too much on the ilium. So your angle should always be, I make contact with the ilium and then let that guide me straight down. I do not work with my direction of force toward the ribs. That way I don't inadvertently hurt the client. As long as I'm mindful, you're never gonna really hurt the bony structure of a client, but I, in the very least, need to be mindful of their comfort level. This angle of, my direction of force and my where I'm looking is towards their feet. And if I just make contact with the ilium and go down, then I know I'm going to hit what I need to here. So related to the low back, you're going to see me focus and reinforce that idea of the erector spinae and lumbar dorsal fascia, the deep lateral hip rotators, and then when they're on their side, thinking in relation to getting a good compression into that lateral raphe, the muscles that feed into that lateral raphe being just about everything. The obliques, quadratus lumborum, psoas, even the erector spinae. So very important to work there. So beyond that, what I'm going to bring out is the other model real quick. Just move these guys. One of our students back in the day created this guy. So, crafting at its best. So almost every muscle is represented with cloth and bungee cords for the tendons. So it works very good in terms of just a general visual of how we work and how I think as I work. So with the client laying prone, let me go and get them bolstered and everything. So with the client laying prone, where I start is the low back. It's going to be one of our most commonly indicated areas of dysfunction, and it's just a convenient spot to start. So I get them bolstered. I will be undraping the area, making contact, and then working on that tissue. So let me go back. We're going to be following pretty much a 4-step process. The steps are going to be draping, undraping the area, making contact with no lotion, moving the skin and superficial fascia. It should look and feel like massage, but this is a way for me to assess how the skin and superficial fascia feels, how pliable it is, if there's anything hot or cold in terms of temperature sensation. So it helps me also reinforce that pattern of working superficial to deep. So no lotion, contact, move the tissue. It can be kind of like what looks like a glide, what looks a little bit like a knead. We are thinking about just moving the skin and superficial fascia as much as we can in every direction. After that, we will apply lotion and then begin with a compression. A pressure check-in for you as the therapist, thinking in terms of what layer of tissue are you in. You should be always thinking I am working superficial to deep. And then with that, we also have to do a pressure check-in with the client. Make sure the pressure is, one, not too much, but that also after we do our initial glide and have warmed up those superficial layers of tissue, that we are also applying enough pressure for the client's satisfaction. So my first compression, what I do in my mind is a pressure check-in for myself. What depth of pressure and what layer of tissue am I on? How much, in terms of the depth of pressure, how much pressure am I putting? And checking in with the client. So after that, we will do 3 glides and 3 knees. These can be at the same angle. If you're trying to simplify this process, you can just do the glides in the exact same orientation and then switch and do 3 glides in a different orientation. You will see me try to be more efficient, so I will usually apply those glides in multiple angles of direction. That is reinforcing that idea of what I was talking about, of making sure the tissue is stressed and moved in every direction. We're going to get more benefit by doing that. So usually when I'm working the low back, for example, I will start my initial glides and applications working perpendicular to the spine and then diagonally. And then I'll come in and do that one stroke where my focus is the lumbar rector spinae and that lumbar dorsal fascia. That applies stress to the tissue parallel to the spine. So in that case, I've done a stroke that goes back and forth, up and down, and on an angle. I may do another one that goes up at an angle this way, but for example, but in general, I, for efficiency's sake, at least I'm not always trying to do applications that go both ways, going forward and back, up and down. I might just pick one. So in this case, I've done one that goes toward the spine, perpendicular to the spine, one that's focused more down towards the pelvis, and then one that is parallel to the spine, but is working up toward the head. That will get at least enough change of shape of the tissue, and then by the time I turn them on their side and apply force here, and supine, where we do that, where I'll do maybe an abdominal pull this way, reaching around and to their low back and pulling. That then is going to stress the tissue in the other direction, or any of the directions that I didn't do here in prone. So anyway, and then with that, when possible, joint movement and or oscillation. So if I can do that in conjunction with the massage application, awesome. But if not, then I just do it separately. For the spine, one of the best things we can do for it is just rhythmic oscillation of usually taking the pelvis, just moving it. I use this as a transitional application as I work from one body area to the other, as well as an assessment tool. So if I massage the low back and then I rock the pelvis, that's going to create rotation and movement in the lumbar spine. And then once I get to the rib cage, I'll be there. It's tougher. We can't move the thoracic spine as effectively, but there I might think more about the scapula / shoulder blade, and then onto the shoulder. With the joint movement idea, it's going to be a little bit easier for me to demonstrate that in relation to the hinge joints, like the elbow and the knee. So here, if I'm working on, my goal is the hamstrings, I'm going to work perpendicular, and then on an angle, and then try to work parallel to the femur. That way I bend the hamstrings, I push them on an angular direction, and then I lengthen them. That's my mental goal here. If I can do that while also applying some joint movement, I'm going to get more stress into the tissue by creating friction between those layers of muscle. So worst case scenario, I can just do the massage of the area and then move the joint back and forth, maybe a little rocking and oscillation, like grabbing the hamstrings and just rocking them back and forth like that. That will still create a level of internal friction as well. So our pattern, going back to our pattern, it's going to be undrape the area, make contact, no lotion, move the skin, and then apply lotion, compression, pressure check in myself and with the client, and then more pressure, turn it into a glide, 3 glides, if possible in different directions, 3 needs, There, if we change, at least where I'm standing, that will naturally get a change of direction and change the stress that I'm putting into the tissue. Then after the glides and needs, some kind of joint movement as I work my way up and through the body. So that's our general protocol. Now, for what we do to each tissue. So now what I'm going to reinforce is where do I start and where do I go? So I start at the low back. I would drape the area, make contact, move the skin, do a compression, pressure check-in, glide, knead, move the joints, and then work my way up to the mid-back and start that whole process over again. Once I have a general gauge on at least what the client's preferred pressure is, I will not always do that pressure check-in, but it will behoove you early on to do that pressure check-in as much as possible. It's good feedback for you, and it also allows them as your client to help guide you in terms of, one, how much pressure they need in each body area. You're not going to apply as much pressure to the arms, for example, usually as you would to the back. So my pattern, beginning, number 1, low back, mid back, scapular region, so shoulder area, upper arm, forearm, hand, and then I go all the way around, low back, mid back, upper back and shoulder, upper arm, lower arm, hand. Then since I'm standing there, I work on the hips, so glute maximus, and then those deep lateral hip rotators. And I work my way to the hamstrings, the calves, and then the foot. Walk around, glutes, deep lateral hip rotators, hamstrings, calves, feet. Then we turn our client on their side. My protocol will turn into, let me actually go this way. Now my goal is going to be, not very flexible, but it will work. Now my goal is going to be where I start is going to be the top leg. So now this is where some picking and choosing is going to have to happen. I don't always work on the IT band region of the upper thigh in this position because I am able to facilitate working in that tissue in prone and supine. But some adaptations for you would be working more on the legs in this position and or even working on the back in this position in the event that the client can't lay on their stomach. So my routine in this position will be top leg. My focus, what you'll see today is the shins and calves, top of the foot. I come around, work more on the medial thigh, so thinking the adductors, hamstrings, calves, foot. Work my way up. Then I will work on the lateral side of the torso, thinking latissimus dorsi, serratus anterior. There'll be some joint movement of the shoulder during that. If I work going back down toward the pelvis, that will lead me right into being able to work on that lumbar area again, that lateral raphe, thinking all those deep muscles like psoas and quadratus lumborum. After that, I come up to the neck and the shoulders and finish there. Then I turn them on their other side and I do it all over again. Top leg, bottom leg, side of the body, down to the low back, neck, and shoulders. Then once they are supine, let me get this. Supine, my spot will be, and I always make sure they're bolstered. This client doesn't look very comfortable. His head doesn't stay on very good, but where I start here will be the quads, the anterior thigh, remembering to work on the hip flexors as well. So I will reinforce certain body areas are seem to get not addressed simply because the draping is complicated. If the draping is an issue or underwear is in the way, just work over the sheet. So, and I almost always have to do that here. It's tough to get the sheet in a position where I can get access to the tissue without it being uncomfortable for the client and or myself. So I work on the thigh as much as possible and then work on the hip flexors over the sheet. I've already worked on the shins and the calves. I don't have to do anything else there. So in supine, I think just the thigh and the hip flexors. Work my way up, and now I'm going to focus on the pecs, the anterior chest, the upper arm, deltoid, biceps, into the forearm and hand, come around, pecs, shoulder muscles, biceps, forearm, hand, and then if there's time, maybe do some more relaxation-based work at the neck and shoulders and even the scalp. So for that routine, real quick, one more time. In prone, low back, mid back, shoulder, upper arm, forearm, hand, walk around, low back, mid back, shoulder, upper arm, forearm, hand, hip, glute, deep lateral hip rotators, upper leg, lower leg, foot, walk around, hip, upper leg, lower leg, foot, turning them on their side, top leg, bottom leg, side of the torso, low back, neck and shoulder. Other side, top leg, bottom leg, side of the torso, low back, neck and shoulder. Turn them supine. There we go. Upper thigh or anterior thigh, hip flexors, chest / shoulder, upper arm, forearm, hand, shoulder, chest, upper arm, forearm, hand, and then we will end with an additional low back / abdominal work technique. So like anything, if you have a longer session, you can always do more, but we're going to be trying really hard to be thinking in terms of that 50 to 60 minute time frame. So the next video will be an actual active demonstration of me doing this, and I will verbalize that whole idea of thinking of a few things, specifically depth and direction. What layer of tissue am I on? How many directions of force and stress can I put into that tissue? And as you learn more, thinking in relation to what am I doing to help facilitate normal healthy function of each layer of tissue. So that basically means for each body area, I'm going to work in plus signs and X's. So, and then our protocol again, we undrape the area, make contact, no lotion, move the skin and superficial fascia, apply lotion, compression, pressure check-in, 3 glides, 3 kneads, move the joints, and then on to the next area. So we'll see you guys in the next video.